Welcome everyone, it's Michael again, and welcome to the body mechanics portion of our home care, homemaker, home health aid training program. All right, let's talk about body mechanics. So remember, body mechanics is the way the parts of your body works together when a person moves. So using proper body mechanics helps save energy, and the most important part is helps prevent injury. So understanding some basic principles of body mechanics will help keep you and your clients safe. All right, so you want to have proper alignment, make sure pay attention to your center of gravity and have a good base of support. So body mechanics, we said that earlier, the way the body parts move and work together when someone moves, right? So we have to talk about posture. It's the way a person holds and positions his or her body. Do you have a crooked posture? Do you have a straight posture? Do you have an S-type posture? But you want to be able to make sure you have that straight posture is the most important thing. Next thing is alignment. Based on the word line, when a person stands up straight, a vertical line could be drawn right through the center of the body. When the line is straight, the body is well aligned. So let's talk about base of support and center of gravity, right? Base of support is the foundation that supports an object. So those are your feet. Do you have is your base support really weak, or are your legs spread apart and you have a nice steady base of support? Your center of gravity as well, right? That's the point where the most weight is concentrated. So the higher center of gravity you are, the likelihood that you will topple over. So you want to be able to have that nice, steady, center of gravity right in the middle. Next thing we'll learn is lever and fulcrums. So lever is something that moves an object by resting on a base of support. That's or a fulcrum. So a fulcrum is the base of support, such as a triangular base. A seesaw rests on it. Okay, so moving on, body alignment. We need to be able to make sure we understand the principles of body mechanics, especially body alignment. You want to be able to keep the object in front when lifting. You want to be able to make sure you point your feet and your body towards the direction you are moving towards. And you want to avoid twisting at your waist. For your base of support, you make sure you have a wide base, is what we have as a more stable base. You want to be able to stand with your legs far apart. Now, when we talk about the fulcrums and the lever, your arm is a lever, your elbow is the fulcrum, okay? The rest of the object against your forearm. So, center of gravity, when standing, your weight is centered in your pelvis, okay? Your hips. Low center provides greater base of support. Bending the knee when lifting is very much important. So, fulcrum and a lever, okay? So now you can see what these are. Now, center of gravity, the lower you are, the better your base is. So let's think about this question as you review and you look into the slides further on. So how can applying the principles of body mechanics to your daily activities help to avoid injuries and lessen your energy usage? Okay, so you want to be able to make sure you lessen your energy, usage, at the same time lessen the chance of you getting injuries. That is very much important, especially when you're working. So when you're lifting a heavy object from the floor, make sure you spread your feet shoulder width apart, bend those knees, use your muscles in your thighs and your upper arms and shoulders to lift the object. Don't use your back, okay? You want to be able to pull that object close to your body, and when you stand up, you want to be able to push with your hips and thigh muscles. You want to be able to pivot your feet instead of twisting at your waist. Always make sure that you face the object or the person that you're trying to move, okay? So make sure you use your legs and thighs for the lifting, not your back. So to help a client to sit up, stand up, or walk, you want to be able to assume that good stance. You want to be able to keep feet 12 inches or shoulder width apart, pretty much. You want to be able to place that one foot in front of the other. You want to bend those knees, okay? Bend those knees, not use them back, okay? Keep your upper body upright and in alignment, okay? That's straight alignment. Now, let's think about this quick question. What is meant by the statement, never try to catch a falling client, and what is the correct response for assisting the falling client on the floor? So remember, when a client is falling, we will not try to catch them, okay? What we're going to do is we're going to ease them to the floor. So it's going to be an assisted fall, okay? What you're doing is if you try to catch them, right? That sudden, stop that occurs because you're catching them can cause injury for them, but all of a sudden can cause injury for you as well, because of the straining. So remember, maintain that wide base of support and low center of gravity. What this does, it always prevents you from getting any injury as well as the client. So let's talk about when making the bed or doing any job that actually requires any bending. You want to be able to adjust the height to a safe working level if possible. Usually, definitely your waist high is always a good level to look at it. If you're making a regular bed, lean or kneel to support yourself at working level. You want to be able to avoid bending of the waist, okay? Remember that. Avoid bending on the waist. So remember, assess the situation and clear the path first. You want to get help. Use both arms and hands when lifting, pulling, pushing, or carrying objects. Hold objects always close to you. All right, you want to push the objects rather than pulling them. Push better than pull. Avoid bending and reaching as much as possible. You don't want to overbend yourself and affect your back. You want to always have your legs facing the person you're trying to work with. You want to avoid that twisting at the waist. When you're needing to move that client, you want to be able to make sure that they are aware. Let him or her know what you will be doing, so possibly the person can actually help with what you're trying to do for the client. So let's look at listing ways to adapt the home to principles of good body mechanics. You want to be able to know some of these strategies. You want to be able to make sure that you have the right tools for the job. Have footrests and pillows available as needed. You want to be able to make sure you have the tools, the supplies, and that you're making sure that it's clutter-free off the floor. Sit when you can. Use a gate or transfer belt. So let's looking at some terms: fracture and disorientation. Fracture is a broken bone. Disorientation is a confusion about a person, place, or time. So let's talk about falls. Some of the causes of falls is those unsafe environments, loss of ability of a person, any diseases possibly, medications can cause it, loss of vision, gait or balance problems, weakness, paralysis, and also disorientations. So some way to prevent the falls would be clear the walkways, avoid waxing floors, and making sure the use of non-skid mats are present. Wear non-skid shoes with tied laces. Wear clothing that will fit properly, not dangle and cause you to trip. You want to be able to keep frequently used personal items close. So if somebody is very weak, it's easy for them to access if they're using it all the time rather than having to get up all of a sudden needing it. That would cause a possible fall. And also make sure you clean up the spills. Avoid the floor from being wet. So other prevention parts of falls is you want to mark the hazardous areas. You want to be able to make sure there's improved lighting. You want to be able to make sure that you lock the wheelchair wheels so that if a person's transferring from their chair to the wheelchair, the bed to the wheelchair, it prevents the falls. You want to be able to return the bed to its lowest position after the care, okay, so that if the patient does fall, it's a lower height, but it also makes it easier to prevent that. You want to offer those frequent trips to the bathroom. You want to offer it rather than them having to solo themselves or having to rush themselves to go to the bathroom and then all of a sudden they had a fall. You want to be able to make sure that they leave the furniture in the same place. Don't move things around because what they're used to already, right? If it's dark, if it's nighttime, they know where their paths are, and if you move some of their furniture, it can cause problems for the patient or the client. And always make sure you identify any hazards and remove it as necessary. Scalds, on the other hand, what are scalds? Scalds are burns caused by hot liquids. So some causes of burns are dry heat. Those are your iron, your stoves, your electric appliances. Wet heat, those hot water, those hot coffees, hot liquids, and steam. And chemicals will be acidic items and lye. Okay, LYE. So preventing it, you want to be able to roll up your sleeves. Okay, check that the stove and appliances are off. You want to make sure that you set your water heater at 120 and 130. I know some people just love that wonderful warm hot bath, but if you play the risk and you don't adjust your water heater, it can cause scalds on you or even your loved ones. You want to be able to check the temperature of liquids with a thermometer or on your wrist before serving it to anyone, your family member, your loved ones, or your patients or clients. So other parts of preventions of burns, you want to be able to make sure, be careful with space heaters, report any cords that are frayed, let clients know if you're about to pour or set down a hot liquid, pour hot liquids or drinks away from the client and keep away from edges of tables, and make sure clients are sitting down before serving hot drinks. Moving on to common types of accidents would be poisoning. So this is caused normally by ingesting harmful substances. So how do we prevent this at home? Lock the cabinets. Post any poison control center numbers in case of an emergency. Check the refrigerator for any spoiled food or goods. Number four type of injuries is cuts. So normal causes of this is like sharp objects. So you want to prevent by keeping sharp objects away from children. Lock sharp objects away. Cut away from body while preparing any food. Okay, not towards your body. Know a lot of first aid for any cuts as needed, just in case something does happen. We know how to be able to heal or try to be able to make sure that things are covered so that we don't have any infections in the future. And the fifth common type of accidents is choking. Some of the main causes for babies are putting objects into their mouth, being unconscious, having, being sick or weakened clients may get or may have chances of choking. Some of the best preventions would be keeping small objects out of reach of children, cutting foods, position infant at their backs for sleeping, eat sitting up, provide thickened liquids for the people that have difficulty swallowing, and also make sure, think about these questions as you view the following as you view some of the transparencies or the slides that's going through. What kind of hazards can you see in this picture? What would you do to make this room safer? So I'm going to show you some photos and tell me, and I want you to start thinking in your head, what can you do to make things safer? Okay, so the first one, what do we see here that can cause problems or hazards? So if I start looking around, if you see the cord that's coming from the lamp that's in front of the little lazy boy, well, there's a cord right there that can cause a person to trip. There's also the books in front of that lazy boy that can cause them to trip as well. If you look at the space heater, okay, that can cause a fire. The slippers, those can actually cause somebody to trip, or you can actually make sure somebody uses a non-skid slippers. Now, if you look at the, I'm trying to think of what this is called, the rug, as you see, it's not properly tucked down, it's not flat, so that can cause somebody to trip as well. Moving on. Right here, what do we see? We see an octopus situation here where there's multiple plugs going on just two sockets. This can cause fire, okay, and it can cause some problems, okay? Next thing, if we look around, there's a wet floor. On the bottom of the sink, you have hazardous materials that are not locked in. So if there's a kid or a child that lives in this house, that can cause some problems. Now, I'm so sorry. If we look on the top, the fire extinguisher, that's a combustible item, and you have it on top of a stove. Also bad. Over here, what do we see? Well, we see the hair dryer that's sticking out. Now, hair dryer, of course, it's going to go by the sink because you're going to be, drying your hair at times. But you always want to make sure you unplug it and you also put it away. Because look, you have wet floors on both by the front of the sink and also right by the toilet. If you look in the bottom right drawer, you have medications that are easily accessible by children. You want to make sure that that is covered. All right, so now let's go ahead and look at some of the fire safety guidelines and describe what to do in case of fire. You want to be able to know the following fire safety guidelines and the home health aide's role in the whole prevention of fire and also safety. So the home health aide's role is to be able to report damaged equipment, space heaters near equipment, flammable materials near equipment, frayed wires, and careless smoking. Never wear loose clothing. Okay, to be able to reduce hazards while you work. Store flammables away from the stove. Do not store items that may attract children near the stove. Discourage smoking in bed. Stay near kitchen when baking and cooking. Do not leave when the dryer is on, and turn off space heaters. You also want to be able to make sure that there's working smoke alarms. Check smoke alarms and replace the batteries once a year. Have fire extinguishers on hand. Check that homes have unexpired extinguishers. Know where they are located and know how to use them. Okay, have you ever used a fire extinguisher before? Have you ever practiced on a fire extinguisher? Well, we use the PASS acronym, the PASS. P, pull the pin. A for aim. S, squeeze. Second S, sweep back and forth at the base of the fire. All right, now let's talk about in case there's a fire. We use the RACE acronym. So you as a home health aide or homemaker, your role goes as follows. RACE. R, remove the client from danger. A, activate 911. C. Contain the fire. E. Extinguish or call fire department. Okay, moving on. Remembering these guidelines for helping clients and their family members exit the home safely. So if there's a fire that happens, how do we help people exit safely? Number one, remain calm. Okay, you have to be the person that remains calm. Know how to exit. Know your exits. Do not try to put out any large fire. And then know where the children's windows are. And also make sure you unblock the window's exits. You want to stay low in the room to escape because if there's smoke, right, smoke will rise to the top part, so the clean air is in the bottom. So stay low because you don't want to pass out. You want to be able to use any coverings to put in your face to prevent, to lessen the chance of inhalation. Check for heat coming from closed doors before you open, okay? Never ever run if clothing is on fire. Remember when we were young or when our kids were young, we learned stop, drop, and roll. That's the most important fire safety technique. And go always to the designated meeting area or space. Okay, so we're moving on to restraints and related problems. Restraints, okay, are a physical or chemical way to restrict voluntary movement or behavior, whether we're using restraints like physical restraints like putting some wrist restraints to the bed, or we're using chemicals, we're using medications to kind of where we want the patient to be sleepy or something just to hold them back because they're acting up, for example. So both are types of restraints. Suffocation is a stoppage of breathing from lack of oxygen or excess of carbon dioxide in the body that may result in unconscious death. The reason why we're talking about suffocations here is because of restraints. There has been so many incidences where people are using restraints improperly, and unfortunately death has occurred through suffocation. So we want to be able to make sure that that does not happen, and if somebody is or needing restraints, that we make sure we monitor them completely. So here are some of the problems that may occur if we're using restraints, whether it's physical or chemical. Number one, pressure ulcers may occur because they can't move around too much, so it can cause problems. Pneumonia as well, risk of suffocation. There's a reduced blood circulation, stress on the heart, and also incontinence as well can happen. Some other stuff that may happen is constipation, muscle atrophy because they're just laying there and they just start getting weak, loss of the bone mass, poor appetite and malnutrition, depression, as well as any sleep disorders. Moving on, they also have the loss of dignity. How would you feel if you were shackled to your bed for the whole time and people can look at you and see you? Loss of independence. You're going to feel that you can't do for yourself no more. You can't handle yourself, and it makes a person feel weird when they cannot help themselves. There's that increased agitation because that client just wants to be able to get out. Loss of self-esteem, severe injury can happen, and of course even death. So restraints can only be used with a doctor's order, okay? So you can't just put somebody in restraint without a physician's order. It is against the law to apply restraints for convenience or discipline. You don't want to be able to put restraints on just because you want to prevent that person from getting an infection or from getting out of bed or from anything, just from minor stuff. It has to have a doctor's order just because it's going to help be able to prevent any problems with you. So there are alternatives for restraints. So restraint alternatives is any intervention used in place of a restraint or that reduces the needs of restraint. Whether you increase the chance of taking the person to the bathroom, maybe they just need to go to the bathroom a lot. That's why they're having lots of problems and trying to stand up all the time. You want to be able to make sure that you improve safety measures to prevent accidents and falls. You want to be able to improve the lighting. That's very important if somebody's in restraints. Make sure call signals are with that they're on restraints. That doesn't mean that they don't need help or they're not going to require it. So they need to be able to make sure that if we do have them in restraints, we also provide good lighting and also make the call light easily accessible by them. We want to be able to make sure we ambulate the client when he is restless. The doctor or nurse may add exercises to the care plan. You want to be able to encourage activities and independence, increase the visits and social interactions with the client. You want to be able to give frequent help with toileting especially. Assist the client with cleaning immediately after any episode of incontinence also. Don't forget to offer the food or drink. Offer any reading material to distract them. Decrease the noise level. Reduce the pain levels through medications. Provide familiar caregivers. Use a team approach to meeting the person's need is also important as well. So why must the client be monitored, constantly checked at least every 15 minutes if a restraint is ordered? The reason why that is recommended is because you never know if they're going to have an accident, if they're going to choke on themselves, or something happens with them. We want to be able to make sure we monitor the client, especially when they are in restraints. So the following must be done at regular ordered intervals if a physical restraint is used. You want to be able to release the restraint or discontinue it. Eventually, offer toileting assistance, offer fluid and food always. We don't want them to get dehydrated. We want to be able to always make sure we position a client every 2 hours because there's a chance of them to be able to get a pressure ulcer if we don't do that. We also want to ambulate the client. So moving on, and we're going to move on to auto accidents, okay? This is very important for all you home health and your homemaker and your home caregivers because you're driving to multiple clients at times, or you're driving to your particular client. You're not going to your office. So we need to talk about automobile safety. You always have to plan your routes. Okay, make sure you have a route plan. Minimize any distractions. So no cell phones. Stop tweeting. Stop whatever you're doing. Okay, just drive. You want to be able to make sure you use your turn signals. Okay, you passed and got your driver's license. So I'm sure that you know the rules. We just need to make sure you follow it, especially when you're working with a company. You want to be able to make sure you drive at a safe speed. If you're typically just driving 15 minutes away, 30 minutes away for wherever you're going to work, driving an extra 5-10 miles an hour is only going to take off a minute to a minute and a half to 2 minutes of your time. So might as well just enjoy the drive, okay? Because 2 minutes is not really going to buy you a lot of time. You want to be able to make sure you always wear your seatbelt. That protects you so much, okay? So now, which of the tips on the previous slide do you already do on a regular basis? And which do you not do yet, or you want to be able to perfect? Especially the part where you need to be able to make sure that you do what? Put your safety belt on. All right. I said a few slides back, don't use your cell phone. So no texting, no tweeting, no emails, or talk on the phone while driving. Not unless if you have those hands-free Bluetooth materials or Bluetooth earpieces. Those are still pretty good and should be utilized because it actually reduces you having to hold on to a phone, and you can concentrate with your other hand on your driving or your steering wheel. So here's another question. Are you a safe driver? If you are a safe driver, when was the last time you got a ticket? When was the last time you got into an accident? If you never had any of these, then you're a good driver so far. But if you ever got any of these before, what could have you done to prevent it? Okay, so using guidelines for using your car in a job. Some places will provide you with a car, some places won't. So for your car, make sure you park in safe areas. You make sure you lock your doors. I know so many home care people that loses their stuff because they don't lock their doors. But also, if you're carrying a lot of patient information, you want to be able to stay strict on the, on HIPAA policies and not being able to risk the files of patients being exposed out there. You want to make sure that you never keep that registration in your car. You want to keep track of miles for your work because that's good for your taxes. You always want to keep your car in good running conditions as well. That's very much important. Your car is your lifeline. You get to work, that's the only way. So remember these guidelines for staying safe in high crime areas, because there are going to be times that we are going to end up working in areas that unfortunately is bad areas as well. So we want to be able to make sure we watch what's going on from there. So we want to be able to park our cars in well-lit areas. Never ever bring valuables at home. Valuables from home and leaving in the car, so just leave it at home. Never ever, leave your purse out there or take your purse with you. Just be able to bring enough to do your stuff for work, okay? Make sure you lock your car. Make sure you have that walk with, with confidence that, you know where you are, you know what you're doing. Okay, more stuff. Carry whistle. Carry keys in hand. Do not sit in unlocked cars. Avoid unsafe areas after dark. Leave areas of concern immediately. Guidelines for staying safe in high crime areas are also good. Here's more additional stuff. Avoid strangers. Call before visits. Avoid vacant houses. Ask for escort if your company provides somebody that can go with you. Call the office at the end of the day. Give someone your schedule. Or you can also call somebody before you enter any work environments. So more questions to think about. Do you know someone who has had an experience in which poor judgment led to being at risk for crime? Has this ever happened to you? How could this have been handled better? So I'm glad that we were able to share this particular setting, this particular chapter. make sure you take advantage and rewatch the video if need to, or you can just go ahead and take the next examination right away. We look forward to hearing from you. If you have any questions, don't forget to give us a call.